Hi students, today let us discuss about an important topic regarding ankle fracture. So ankle fracture, when you have to think about ankle fracture, you need to know about something about ankle joint. So what is ankle joint? Ankle joint is basically a modified hinge joint. It's a modified hinge joint. So it allows various movements like dorsiflexion and plantar flexion and external rotation, internal rotation. It promotes such movements. So regarding ankle joint, we need to know about articulating surface. Basically, the ankle joint is formed by three bones. One is tibia, fibula, and articulating surface of malleoli. Malleoli, that is your medial and lateral malleoli, and finally your talus bone. These all articulating surfaces is lined by hyaline membrane. This all articulating surface is lined by hyaline membrane. Yes. So, and let us talk about ligaments. Basically, the ankle joint has two groups: medial, lateral. Medial collateral ligament, lateral collateral ligament. This medial collateral ligament is also called as deltoid ligament, and it has two groups: superficial group, deep group. The superficial group is tibiocalcaneal ligament, tibiocalcaneal ligament, and your deep ligament is called as tibiotalar ligament, tibiotalar ligament. And your lateral collateral is having three groups: anterior, posterior, tibiofibular ligament, anterior and posterior tibiofibular ligament, and calcaneofibular ligament, calcaneofibular ligament. So these are the group of ligaments present in the ankle joint. So this is important to know, remember. Okay. And the next one is, before going into the ankle injuries, you need to know how the ankle injuries are most commonly happening. Basically, the ankle injury mechanism of injury is not known. So it is not known. It is under exploration, because it is clinically very inconsistent to note ankle injuries. But basically, most commonly there will be a history of twisting injury in ankle is present. There will be twisting injury of ankle. Okay, so this is important. And regarding ankle injury, you are having two groups of classification. One is Dodge Weber classification, and another one is Lodge Hansen classification. Sorry, this one is Danis Weber classification. This one is Lodge Hansen classification. Okay, Danis Weber classification, Lodge Hansen classification. Your Danis Weber classification is based on the fracture line location to fibular syndesmosis. Okay, so basically ABC. A is below. The fracture line is below the fibular syndesmosis. B is at the level, and C is above the fibular syndesmosis. Okay, And your large Hansen classification is very important. It is based on three movements. Okay, one is supination, external rotation, supination, adduction, pronation, external rotation, pronation, abduction. So this is the order of injury too. So at this time only the injuries will be more common, and your last is your vertical injury, and your vertical injury is also called as pylon fracture. Okay, sir, sad, and per and pa. So in this we are having several order of injury. So it is based on the order of injury, how the order of injury is being happening. Based on that, this large Hansen classification has been classified. Okay, so you rotate and see your ankle. Okay, wow. So in supination and external rotation, in supination and external rotation, in supination and external rotation, you might see an injury in your an injury in the lateral part, that is your anterior inferior tibiofibular injury, and followed by spiral injury, and followed with posterior tibiofibular injury and deltoid ligament injury. So this is the order. Likewise, in every rotation, you might have uh, some fractures. Okay, wow. So that you need to understand with the knowledge in the practical aspect, which will be explained separately as a short video. But for now, for UG level, you need to understand this large Hansen classifications based on the four movements. This is per se enough. But in order to have a knowledge, to have a deep idea, you need to know how the injury is happening and what is the order of progression of the ankle injury. Okay, so that will be explained in a separate short. Okay, next. So next is clinical feature. Features of fracture. What are the features of fracture? Pain, swelling, deformity, shortening of limb, all those things. And on your sign, what is tenderness, swelling, all those things will be there. For specifically ankle joint, what will be there? As I told you, history of twisting injury. This is important. And for sign in the ankle joint is crepitus. So they saw that these signs of the ankle joint. And as I said in investigation, everything AP, lateral view, X-ray. These are all common for everything. But specifically you need to do here, that is your mortise view. That is 15-degree internal rotation of foot. On that movement you check for X-ray to have a detailed view of foot. You do this. Okay, and your management is completely based on the fracture without displacement and the fracture with the displacement. If the fracture without displacement, you will keep below knee plaster for 3 to 6 weeks, or any cast. You will put any ready-made cast. Ready-made braces. Sorry. Knee ready-made brace. If the fracture with the displacement is present, then it is a critical one. Now you have to check what is displaced, whether it is medial malleolus, lateral malleolus, or posterior malleolus. If it is medial malleolus, then you can expect three type of fracture: transverse fracture, avulsion fracture, oblique fracture. Then transverse fracture is managed with tension band wiring. Avulsion fracture is also managed with tension band wiring. Oblique fracture is managed with compression screws. Again, in lateral malleolus, we can expect four type of fracture: transverse fracture, spiral fracture, comminuted fracture, and your lower one-third fibula fracture. As I said, in transverse fracture, tension band wiring, spiral fracture, as I told you, compression screws. In comminuted fracture, you will plate buttress plate. Lower one-third fibula is your four-hole plate. And your posterior malleolus. In posterior malleolus, again it is of three types, involving less than one-third of articulating surface, involving more than one-third of articulating surface, tibiofibular syndesmosis. If it is less than one-third of articulating surface, then no additional treatment. If it is involving more than one-third of articulating surface, you manage it with internal fixation with compression screws. If it is tibiofibular syndesmosis involvement, then you do then you put long screws from fibula to tibia. So this is regarding your ankle injury. Your ankle fracture is also called as Pott's fracture. So this is regarding your ankle injury. Thank you.